TB?
The answer is 2. Just that you've been exposed doesn't mean you have TB. All right, number 2. Okay. Now, most of you are too young to remember this, but I still remember it. Christmas seals. Christmas seals we thought were supposed to put on every single Christmas card we wrote. Now, not many people do that anymore. Christmas seal. And this one was the perfect thing. It says, healthy looks can hide tuberculosis. The x-ray will show it before you know it. And that is exactly true. But Easter seal, the whole thing behind Christmas seals was to help eradicate tuberculosis. Problem was, it was unsuccessful. Number 1, TB is an infectious disease that's caused by Mycobacterium tuberculosis, okay? And it involves the lungs. But the bad thing about TB is it does have the potential of migrating elsewhere in the body. All right? It kills more people worldwide than any of the other infectious diseases. 2 billion people in the world have TB. And in the U.S. alone, we have 15 million people with TB. Okay? That's a lot of people. And there's approximately 8 new cases a year, with 3 million deaths. So TB is still there, and it's still causing problems. And the thing is, in the late 40s and early 50s, though, they finally found chemotherapeutics that would kill it. And it was INH, or ionizide, and streptomycin. I'm supposed to be sticking with rules. Okay. Well, what they found then, all of a sudden, okay, so it started killing it off in the 50s. Why? And then all of a sudden, it started to rise again in 85. And now, since 93, it's starting to trend down again. And like I said, there's 15 million people walking around. You know, somebody sitting right here could have TB for all you know. Okay? But there's 8.5 cases per 100,000. It's still in 2000. So it's still there. But the reason we have 15 million people still with it is a lot of them have what we call latent TB, which you're going to figure out in a minute. So TB's there. This is what the little bugger looks like. And he's floating around in your lungs. But now, see these nice little powder puff things? Just keep that picture in the back of your mind. Those are called tubercles. And we'll be talking about, okay? Now, who's the risk factors for? Number 1, anybody with HIV. TB is epidemic among the HIV population. It's epidemic. A lot of times, it's immigration. They're coming from another country that has TB going around that is untreated, and they migrate to our country, and they come in with active TB. Okay? Anybody that's immunosuppressed is susceptible to it. The poor and the underserved, these are our minorities. Also people that are homeless. And amazingly enough, because of how close the contact people are in, it's also very rampant in the inner cities. Don't move to New York. The older people, institutionalized people, IV drug users, Native Americans, specifically Alaskan natives, and also American natives that live in Arizona, New Mexico, and anybody along the Mexican border. And then socioeconomically disadvantaged people. But guess who's at the highest risk for TB? Healthcare workers. For the longest time, we were required for our evaluation to go get a PPD test done. They decided that only the people that work in high-risk areas now have to do that. But healthcare workers are at high risk of TB. Now, pathophysiology-wise,
why IV drug users?
Because they're sharing needles and they're in close proximity to each other. Now, how do we get it? It's all airborne. Airborne droplets. You can get it from a cough, a sneeze, talking to somebody, singing, it's all airborne. Now, you can get exposed to somebody with TB for a brief period, and you're probably not going to come down with it. But it's usually people that are in repeated close contact with the individual that will come down, and that's how it starts spreading. Okay? Now, what these little microbacteria things do is they implant themselves in the bronchioles and the alveoli, and down there they start multiplying, because remember, down there it's sterile. There's no resistance. Okay? So they're going to start multiplying. Now, of course, our little macrophages, our scrubby bubbles, our phagocytes go flying on in there and eat up these little buggers, these little things. And now they become inoculated. All right? And what happens is the cellular immune response, boy, I tell you, I can tell it's different. You know that dyslexia at its finest. Dyslexia at its finest. So anyway, so these little inoculated macrophages, they start the cellular immune response. And what happens is they start clumping together. These inoculated little macrophages, they start clumping together. And that's what makes the tubercles, those little white powder puffs. Okay? Now, what's interesting about it is those little tubercles can sit there and be confined for years and years and years and years and years. And that's latent TB. But if that person becomes their immune system becomes compromised or weakened, they can become active at that point. All right? Approximately 90% of these little tubercles will just calcify and heal completely. But what they do is they create cavities within the lung itself. Only 10% of them actually become true and active, where you actually now become fully infectious. Okay? Now, these little tubercles are also called epithelial and cellular granulomas. Okay? And this is when all these inoculated macrophages are clumped together. But it takes anywhere from 10 to 20 days. So what can happen here is you can be walking around out there doing your everyday thing, being totally infectious, and you don't know it because you're not showing any symptomatology. Okay? Now, what happens with these tubercles is, number one, one thing that can happen to them is they become very necrotic and they liquefy. And they get into the lymph system, and that's how it can migrate to other parts of the body, through the lymphatic system. Okay? And then the other part of it is that liquefaction also drains into the bronchi and causes these cavities when they start calcifying. But that liquid is also what can make it active, and you can breathe it out into somebody else. Okay? These fibrous calcifications, when they occur, can actually be seen as collagen scarring in the lung tissue on X-ray. All right? Now, if it does hit the lymph system, it's going to go through the bloodstream, and it's going to hit places like the upper lobes of the lungs. It can hit the kidneys. You can have tuberculosis of the kidney, bone, cerebral cortex, and your adrenal glands. Those seem to be the ones that TB likes the best. But now it's on the move. Okay? But, as time goes on, your natural cellular immunity, hopefully your immune system will get strong enough again, and it's going to limit further multiplication of these things. It just takes time. And like I said, you can see where things are going. There's a cavity. Here's a cavity. Here's the multi-lymph node going on. And it's all because you inhaled it and it went down there. And it started all its fun. Buy Christmas seals, stamp out TB. And I'm telling you, I was, as a little kid, I was forced to lick every one of those damn things and put them on the back of the envelopes. My mother used to write like 60 Christmas cards. My tongue was all... Okay, signs and symptoms. All right, like I said, early The patient is going to be symptom-free. They're not, and it's probably only going to be found accidentally. And usually, most of the time, it is. Okay? But eventually, you're going to start seeing changes. And the first thing you're going to see is weight loss because they have a loss of appetite. They're going to have a fever, but the thing is, the fever will only be low grade. It's nothing that's going to alert anybody that something is wrong because it's a low grade fever. They're going to start having night sweats, which in women's cases we think it's menopause. Okay? But the biggest sign and symptom you're going to have is you're going to have a cough. And the cough is going to become more and more frequent, and the little bit of sputum production is going to become a lot of sputum production. And of course, because of the coughing, you're going to have painful breathing, you're going to have chest pain, which is pleuritic pain in nature. You're going to get exhausted because you're spending your whole time coughing. And again, little blood vessels can break and we can have hemoptysis. But the cough and mucus production is pretty much the earliest sign and symptom. Because if you've got a temperature of 99, you're not going to think much about it. So how do we go about diagnosing this? Well, number one, we're going to look at medical history. We're going to do the physical exam. But the biggest thing we're going to do is the Montauk's tuberculin skin test, or the PPD. Now, there's other tests, because if that one's inconclusive, but the symptomatology looks still very suspicious, they can do a quantiferon TB test, but it's much more expensive. The other thing they're going to do is take a chest x-ray. Let's see what's going on in the chest. Okay? But final confirmation that this person has TB is going to be diagnostic microbiology of the sputum, and they're going to do AFB culture. And that's an acid-fast bacillus smear, because the mycobacterium are gram-positive acid-fast bacillus. So that's the AFB is going to be the final confirmation that yes, you have TB. Now, remember in pharmacology those little hot dogs you were playing with? Well, that's because the PPD is an intradermal injection. PPD is a purified protein derivative. That's exactly what it is. That's why I got PPD. Now, it's going to be intradermal and it's done in the forearm. All right? It's going to make a bleb, or what we call an induration. We do not want to rub it and massage it once the induration is formed. We want to leave it alone. And then between 48 and 72 hours, we're going to read it, because here's our induration. But then you have a reddened area around it that's going to form. That is called the wheal. And we want to measure in millimeters the width of the wheal. Now, a positive result for a normal person is any measurement greater than 10 millimeters, 10 or equal to 10 millimeters when you measure the induration, the wheal. Okay? But the problem we have is in immunocompromised patients, we can get false negatives. So they consider in an immunocompromised patient anything that's greater than or equal to 5 millimeters to be a positive result. All right? Now, just because it comes out positive is not going to tell us if it's active TB or if it's latent TB. Okay? It's just, you've got a positive one. And once you've got a positive PPD, you will never get rid of it. Okay? Now, the thing is, to get the actual initial infection, it's going to take, from the time of exposure, it's going to take anywhere from 2 to 12 weeks for the infection to start appearing. 2 to 12 weeks is a long time that you could be walking around there actively infectious. I saw a hand go up way back there. I can't hear you. Scream. If you talk too softly, or else get somebody who's loud enough.
It's asking about the vaccine for TB that's given in other countries to get a false positive from that.
Yes, we're going to talk about that. Okay, so like I said, it has to be read between 48 and 72 hours. And all we're doing is measuring that wheel around the end duration. And if it's equal to or greater than 10 in a normally healthy person, it is a positive. Otherwise, if they're immunocompromised, it's 5 of them. All right? And then, like I said, on chest x-rays, you're going to see things like multinodular lymph nodes, multinodular. Nodular? Nodular. I told you it's the end of the day, I need to go home. But it's going to be up in the lymph node area. This is a cavity that has formed from where it drained in there and calcified. And here's old lesions that have calcified. So the chest x-ray is going to show it, but it is not the final confirmation of it. Okay. Now what we're going to do is we're going to need 3 consecutive sputum samples on 3 consecutive days. And it's done first thing in the morning. Now, and that's when we're going to go for the acid-fast bacillus smear. Now, if they can't cough up anything, we can always use a bronchoscope and go down there and get stuff. But what do little kids do? They swallow everything, right? So needless to say, with kids, we would probably have to do a gastric washing because they're going to be swallowing everything. If we think that it possibly has gone extrapulmonary, outside of the pulmonary system, we might want to go ahead and check our CSF. But like I said, and even after getting these sputums and washings and everything else, it's still going to take 6 to 8 weeks for this mycobacterium to grow, because it grows so slowly. Now, there is a new test out there called the NAA. It's a nucleic acid amplification, and it gives a much more rapid diagnosis. But again, expense has a lot to do with it, and not everybody has the ability to do that. Now, when it comes to the drug therapy, we're usually going to treat these patients with up to 4 different drugs, okay? And it's usually the INH, the rifampin, the ethambutol, and pyrazimide, and the streptomycin. And it's up to 4 of them. It'll be a combination of 4 of them, all right? And that's so that we can make sure we definitely eradicate it. So number 1, we have less likelihood of having multiple drug-resistant TBs out there floating around. All right? The problem here we have is TB, their treatment has to go anywhere from 6 to 12 months. Now think about it. These drugs are not cheap. Matter of fact, no drugs are cheap anymore. So if you're getting 4 different drugs and you've got to be taking them for 12 months, that's going to cost. And if you haven't got a lot of money, that's a problem. All right? But like I said, multi-drug therapy is going to reduce the chance of drug-resistant strains of this stuff. Now, they have found that sometimes shorter courses, like 6 to 9 months, have been effective in certain people. But most of the time, they all go for a full 12 months. So when these patients are going home, patient teaching is going to be crucial when it comes to the drugs and the side effects. And the fact that they have to complete the therapy. Now, patients who are on antiretroviral drugs for HIV can't take the rifampin, so they'll have to be on the other 4. And the HIV patient is going to be treated for 18 months, so it's even longer. Rifampin and pyrazimide are going to be always given together for the minimum of 2 months of whole treatment plan. Okay? But
The 2 months, is that for HIV patients?
no, that's for everybody. Now the thing is, you're going to be getting weekly sputum cultures in the beginning, and eventually it will slowly progress as you get farther into the treatment course. down to monthly, they'll be doing a sputum culture. Okay? But if it is found that a person has active TB, they will be put in the hospital in a negative flow room. Now, a negative flow room is where air is pumped in, but anytime you breathe, it is blown out to the outside because a microbacterium is susceptible to sunlight. So they'll be pumping air in, and as they're breathing and stuff, it's all going to go out to the outdoors. The problem here is you're going to be in that negative flow room for anywhere from 2 to 3 weeks, or until you have 3 negative AFB smears. Okay, now think about it. A mother of 4 small children, active TB, has to go in a negative flow room for 2 to 3 weeks. All right, or a single father who has to go in a negative flow room for 2 to 3 weeks. And it's going to put it's a lot of strain on the person that's in there. Number 2, the only thing they see when people come in there is masks, gowns, gloves, you name it. Because if they're active, that means every time they cough, because they're going to have that cough, it's going to be sitting on the side rails. The droplets will be on the side rails of the beds. It'll be on the overhead table. It'll be in the bedside stand. It'll be on the computer screen. It'll be on everything. But can you imagine the psychological effect it has to be stuck in a room for 3 weeks and you can't come out? So, a lot of compassion on our end has to be going on during this process. They have to be told that it's only temporary. Okay? The problem we find, though, even with all the drug therapy and everything else, that 35% of the patients that are treated with TB and don't respond within a year of the drug therapy, it's because they probably have drug-resistant TB. And nothing we can do will kill it. Matter of fact, when I was on 11.5 a couple years ago, we had a guy that actually came down from Volusia and was put in the negative flow room because he had drug-resistant TB. He was hoping that Shands would come up with some medical miracle to cure his TB. He was there for a month. They couldn't find a way to do it. Okay? But 35% of the patients after a year of treatment will not respond, and that's because they got drug-resistant TB. But think about it. Okay, so you're up to 4 drugs, big expense, taking them for 12 months. What's going to be our biggest problem? Non-compliance. They're going to say, oh, well, I took it for 6 months, I'm probably fine. Or I'm running out of money, I can't afford my drugs anymore. This is another reason why we have drug-resistant TB out there. Okay? They have to understand that they have to take these drugs for the full duration and that it's the highest priority to do them. Now, my girlfriend is the TB guru in Marion County at the health department. And she said she finds patients coming in quite frequently and they just immigrated. I might immigrated here and everything else, and they don't have a doctor, so they go to the health department and they do the chest X-ray, and the whole family has TB, active TB. She says it's constant. But down in Marion County, for those non-compliant people, they have DOT, direct observation therapy, which means the person has to come to the health department every single day, be handed their pills, take their pills, open their mouth, show they swallowed them, and they can go on their way. If they do not show up, police are called and they're brought in. And I'm serious. The police will go hunt them down and bring them in to get their pills. That's the only way, because this non-compliance is giving us, that's why we can't eradicate TB, which is what we have wanted to do all along. Okay? Now, even after you complete the whole course and you are deemed free of TB, You have to be followed up within 12 months after the end of therapy, just to make sure. All right? The other big problem with all these meds is they are hepatotoxic. So they're going to be doing monitoring liver enzymes throughout this whole course to make sure liver enzymes. And it makes it even more dangerous with somebody with pre-existing liver problems. And the side effects are tremendous when you start adding all these drugs together. Now, if they have latent TB, they're given INH, and the INH they're taken either once a day or twice a week for anywhere from 6 to 9 months. Because all they have to do is have their immune system compromised and it can activate and become active. All right? Now, they say 9 months is probably more effective than anything. And these patients aren't acutely ill. They're fine. You would never know. Okay? Now, there is a vaccine for TB, and it's called BCG. But its efficacy is not clear. And that's why it has not been cleared in the States. You had it. Well, but they said scientifically they cannot figure out why it is or it isn't working. They don't know for sure. Even though they give them the vaccine, they still put them on the treatment for 12 months. Okay? So you got to think about that when you're talking to these patients. This is going to become a long-term thing. Nursing diagnosis, of course, ineffective breathing because you're coughing again. Imbalanced nutrition, less than body requirements because you lose your appetite and you got the weight loss occurring. Non-compliance related to knowledge deficit, sometimes lack of motivation, and the long-term nature of the treatment. A lot of these people are lower socioeconomic individuals and homeless people, so ineffective health maintenance is definitely in the play, and then activity intolerance. So what's our little role? We're going to screen high-risk populations and identify them. And if they have TB, we want to know every single contact they have been around. And those people will have to be brought in and tested also. Number 2, if they are in the hospital, it needs to be reported to the health department. And the health department reports it to the CDC. And that's how we have gotten all the statistics on how much TB is really rampant around here. Okay, it is federal law that is reported to the database. But like I said, if they're going to go into necessarily respiratory isolation, they have found the negative flow rooms are effective, but like I said, you're stuck in there for 2 to 3 weeks. They have been doing some work on it, and they have found that ultraviolet light has helped with killing the bacillus. So sometimes some of these negative flow rooms at night when the patient is sleeping, they will put an ultraviolet light on in there. For us though, what we need is a high efficiency particulate mask, and these are called HEPA filter masks. They're specially fitted masks. And when you go, it's an individual fitting, and when they put it on you to see if it fits tight enough, they put all sorts of nasty smelling stuff underneath and see if you smell it. Until you can't smell anything, then you got the right size. The newer cool thing they got out there, and I just saw this for the first time when the drug-resistant guy came in, they have these helmets for the nurses to wear. And it's got a plastic piece that goes under your chin and attaches to the helmet. And it's got a little motor back here and it keeps blowing air inside the mask. But it looks just like a construction worker's hat. And that's the new kit. I said, oh my God, we have pictures of it and it is funnier than this thing. But that's the new kit because they found that if the HEPA filter was even slightly loose, you were getting exposed to the TB. So they got this new headdress thing that the nurses wear. Patient education, they gotta learn to cover their mouth and nose when they cough and sneeze. All right? Okay, we got to make sure hand washing. We also, like I said, gel in, gel out, and wash, 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 wash. They need to be taught medication compliance and the rationale behind it. They also need to know that the health department is going to be notified. I mean, why keep it secret? Get notified because it's going in the database. But, 5% of the patients are going to relapse. Even after they get through the full gamut, 5% of the patients that have been treated will relapse. So they got to know the signs and symptoms so they can get help early. The total ultimate goal originally was to eradicate TB. It didn't happen. It's here to stay. And there's nothing we can do about it. And you've got to understand one thing, especially the older people. I even remember this. For me to remember this is a big deal. There is a big social stigma attached to TB. In the old days, patients with TB were put in TB asylums, just like leopards were put on an island. Well, how do you get better when you're around everybody that has TB? Okay? So the point of the situation, there is still a very big stigma associated with TB. All right? And I got to admit, this was one of the asylums up in Pennsylvania. It is now a college. I hope they really clean that place up. But you got to remember that these people, they remember these sanitarians, and so you reassuring them continually is going to be needed. And when they come in for an office visit or they come in to get a sputum sample done or whatever, you gotta be kind to them and say, how are you doing? Are you still keeping up with your meds? Constant teaching throughout the whole course. And here we go. Nurse, get on the internet. Go to surgery.com. Scroll down and click. Are you totally lost icon? All right, I told you we'd get done a little early. Yep. I want to see how many people snuck out of here. That's what I did. In what way?
So if somebody with diabetes, you walk in on them and they're unresponsive, like in the hospital room, kind of what's the first step?
Get a blood sugar.
Okay.
Is this your diabetes homework?
No. No, I just came across that question on YouTube, and so I wanted to see kind of what you guys
blood
said.
Sugar. All of a sudden I find them unresponsive and they're diabetic. That would be my first action.
So is gelling in, does it replace the hand washing?
They say yes because of the Purell, because the Purell is, and just like that little comic says, it kills everything.
Do you wear gloves when you're giving meds?
I wear gloves every time I walk into a patient's room. I'm not going near these patients without having gloves on.
Yeah.
I ain't crazy.
So if somebody is NPO, what do you do with the meds? Like if they need meds?
Chances are it'll either go IV or they will have a feeding tube and it goes down the feeding tube.
Otherwise, can they do like just a small sip in meds or no?
Half a mask. Half a mask. Half a mask.
Thanks.
Chris, I have a quick question for you real fast. For the medication, do we need to know anything about it or just pretty much put power from the side?
You just need to know the meds, that there's meds. Yeah, I'm not going to be asking you side effects.
Okay,
No.
cool.
But we need to know the names and what.
You need to know the meds. Yeah.
What's that? No,
How did you do this?
I didn't take it.
You didn't take it?
Sick. So I missed lab. I missed everything yesterday. So
So you're going to take
and I'm gonna get points off for it.
3 points there.
They can do up to 8.
It's a pretty good reason.
Earned those, and I went to the.
You're going to take it. You're going to take it Friday? Yeah, I'm waiting to see if they get those points back for whether or not. But Friday.
Yeah.
I will tell you as much as you can because I've heard
What's that?
Study as much as you can because I've heard the makeup test or something.
They have 4 fill in the blank and makeup. Just 4. But still, I mean, if you miss them, it's 8 fucking points. How'd you do?
80.83.
Okay.
Yeah, but I needed like 85, so I need an 82. I needed an 83 or an 84 on this exam, so I have to make an 86. I'm going to try to make an 86 on the next one and a 62 on the final or 65 on the final, something like that. My goal was to make above 70 on the final, though. That's hard.
I know, because I feel like I don't have control. Like, I used to have control to some point with the test. You know, I could go for an A if I get a B.
See,
I don't feel like I have fucking
but
control.
I went from making all A's to squeaking by this semester.
Yeah, it works.
I was on the dean's list until this semester.
Until this semester?
Yeah.
You mean like last semester?
Yeah, I was on the dean's
With
list.
farm and everything?
LA, I still made the dean's list. So,
Did you feel like this test, that there were like surprises that you didn't feel like you were taught? Why the hell do they do that? Like, it's hard enough with all the information.
diabetes, I only missed either 1 or 2 questions. I destroyed diabetes. Diabetes was so easy to me. But what was not was the legal lecture killed me.
Well, I don't understand what kind of questions there could be with legal.
I don't know, like it was like all applied, and those got me bad. I don't even remember because as soon as I saw the grade, I was just like, crap, and I exited out of it. But it was hard. And then there's some cancer questions on chemo that I don't remember going for. So definitely study as much as you can.
So, what would you recommend studying with the legal? Because I'm kind of look at it and I'm going, I don't even know how that could be.
Book.
The book?
You have the book?
Yeah.
Skim through the book a little bit, and then definitely focus on the nursing, standards of nursing and the Nurses Practice Act.
See, I looked because she said that people get those confused.
Make sure you know those, like
The difference
back of your
or
hand,
like.
and what each one of them does.
Okay.
Make sure you know them like the back of your hand.
Okay.
But the only thing is, I don't know if your testing is probably gonna be different than what we took.
They're gonna, I know they do switch some things around, but some of.
Some of them has to be the same.
Yeah, because they don't like making the freaking tests. That's why they say it's all about the tests, and it's all about you passing the NCLEX. And if you can't pass our test, and that's why they're so strict on that. But I go, well, if that was the case, then why would you guys not just give us lots and lots of test practice, right? And then when we get things wrong, you say, okay, this is why you got it wrong, and you know what I mean, and teach us how to pull out certain words, and that's what they should be doing all semester versus. You get 3 tests, you screw up, that's it,
I'm on this like crazy. About to go to TLC and work on some stuff, but
What do you do at the TLC building?
just study.
Just inside one of the rooms?
Yeah.
Type thing?
Well, I'm going on the computer now. There's an online lecture. I'm gonna go watch it real fast.
I don't like those online lectures because you're stuck to the freaking computer. Just use a different
I'm
system.
pretty sure I've heard Jordan questions are straight to the point.
Right. Absolutely.
I mean, I don't know if you have the PowerPoints for these or not, but she was reading like word for word off the PowerPoint.
Really?
I only had like.
Well, because I missed yesterday, so that was Jordan, right?
Yeah.
The pain one?
Yeah, I didn't take probably any notes on that. It was,
Okay.
I hate
That makes me
'cause
feel
I always
better.
feel like I have to write stuff down. And I'm like, same thing this morning. The one this morning, that lecture sucked this morning.
There's no information on the
Yeah,
freaking
I'm
thing.
gonna have to read the book for that one. That one
Yeah.
sucked. That was terrible, actually.
Yeah. And she's so nice.
She's not. Her lecture was terrible, and it was
Yeah.
really fine print, and I hated it. I was
Is
like,
that just
"Can you
me?
blow it up a little bit?" I mean, no, I could see it, but I'm just like, it's pain in the butt to like read it that small. I had to like try to write it in.
I'll walk the dog and I'll bring my the notes with me, and if it's small, like,
Can't see it 'cause you're
no,
reading it.
these are good.
Yeah.
Dark, bold. I
You
feel like
you could actually print that, reprint those out, and then cut them in little squares. Those are like flashcards. You could literally just,
yeah.
you could literally cut that and just stick it on the back of a flashcard.
Look what I did. I don't even know how I did it. I didn't do it again, but with the introduction to cancer. Where look, cancer. Look how that came out. I don't know how, but they were like pretty close together, 9 on one page. But I couldn't do it again. And then the one from this morning was came out so small. It was and it had no lines, and that's how it came out. Is that how yours came out?
Yeah.
They need to have a little class where we tell them what benefits us, so they could all use the same program.
I like three on a page with lines next to them.
I don't, because I just don't.
I like waste paper. I will burn it. It kills the trees. I need to be able to see.
Well, how does that make you see? Because the slides are the same thing.
They blow them up a little bit. And it's for me when I handwrite stuff. I like to have them like write it all out.
Yeah.
6 on a page. I kind of feel like I'm cramming for room.
Yeah. Look how small I had to write.
Yeah. That lecture was terrible. Yeah, I'm gonna.
See, those are the things where you kind of go, oh, it's kind of common sense.
Yeah.
But they're the ones that will screw you on
Yeah, I'm
the
gonna text my friend and be like, how hard was her lecture?
You're trying to send this one off.
Yeah. And you've already graduated. But anyway.
Do you ever get any tips on what kind of...
Sometimes I do. Not really question-wise, but like what to like key into.
Yeah.
Study. But it hasn't helped me yet, though.
Yeah, usually it varies. Like
Struggle this
today, for
semester.
some
It's
reason,
real.
I'll tell you what, if I was
8 o'clock, but I don't know why that.
if I had a bunch of people and the ones ahead of me, I'd be like, listen, everybody just take like 5 questions from this, just to try to generally remember.
But you take 1 through 5, 5 through 10, 15 through 20.
Seriously. And the thing is that I feel like we work so hard to know the material, and then we get robbed of it. That's the difference. Like, I feel like that's really unfair. When you guys are making questions up where you go, well, that's not what it means, or says, and they're like, that's what it means. And you're like, but that's not what it says. So if I'm reading into the problem, and they say, well, don't, until you don't. And then I'm like, well, no, you didn't see that it says with instead of on, or whatever.
It's aggravating. It is. That's nursing.
Well, why is that? Like, you guys are in the nursing shortage, right? And it's because I can skim by with a 78, right? And I can get through, which means I only know 78% of that information. When if you said, you didn't really get the information, you didn't really understand it, give people another chance to take a test so they know it and they're even better next, You're not...
I wish we had a second. Even just one exam per mini master. You just got one.
Yeah.
Just one exam. I'd be glad to retake the first one. My first one killed my grade.
Me too.
So, anyway, good luck.
Well, I'm glad that you did well on the test, though.
Yeah. I was hoping for an 84 though. I'm hoping I'll get points back then. I'll bump it up to like an 83. So, good luck on your exam.
Thank you.
Are you going to go to clinical tomorrow?
I'm going to everything from now on.
Alright. I'll see you sometime.
All right. Bye.
Not knowing the behaviors of
then definitely. And so what we're going to do if we do patient appreciation on Thursday or something, when you're not doing your clinical, then if anything, we can always do a brief overview of how Kelly will be there. Like, maybe we don't have to like detailedly go through, but it needs to be like, okay, like, we added this to this slide that we discussed, or like, you know, here's some example questions that we went over that might help you better. So. Yellow's kind of hard to see.
It was a good idea. Like, have some pencil, okay?
Yeah. Okay, cool. Yeah, just let us know.
Yeah, we can text tonight and I'll let you know.
Yeah, because tomorrow, yeah, I said I have nothing, and I'll put it all down for everything.
Yeah, I have.
I usually get up like
good.
with the start study, like I fresh, you know, I think it's best.
That's why I also feel like it's better for us to do
I think
it
so.
afternoon rather than maybe like well for tomorrow.
Yeah.
Because that way the second half of the day then we can do whatever personal stuff we want.
Online, yeah.
Yeah.
So that, I know. What? Lady. Alright, so just text us, I guess, for time. I'm down for that way, I don't know, but yeah.
I am too. I parked.
You parked far.
I did. I parked like straight parking spot and drove straight down. That's where I parked the last time.
Hello?
Hey,
Hi.
how's it going there?
Nice.
What are you doing?
Talking to Jonathan, talking to Jordan, listening to music.
In your room?
Yeah.
Where's Willa?
Living room.
Has Willa been home alone all day?
No. She's been here with me all the time.
In your room?
For partly.
Her, the cat's been out?
Yeah.
You sure about that?
Is the cat in your room?
What do you mean?
Mama, what are you asking me?
The cat was in your room. Did you let the cat out? Then I said, are you sure? And you said, is the cat in your room? So, did you let the cat out? Ugh. When did you let the cat out? All right. Well, all right. I was just seeing what was going on, so I'm probably just gonna be staying here for a little bit. All right. Love you. Sorry, Daniela, I didn't even know you were here. How have you been?
Good, just studying, you know, like, as much as I can. Just making it through.
What did you think of this last test?
I emailed the professor actually because I did not get any original therapy questions.
I didn't take it yet, just so you know, yeah. But I heard, like, that there were ones with the chemo or whatever that...
Yeah, make sure you listen to the lectures online. Like, he said it was there, I didn't see it.
Like, he said it was on the actual...
PowerPoint. Yeah. Yeah, like, I don't know, he just runs and like, I just don't agree because we didn't even cover any of like the chemotherapy, actual treatments like in class, and he had like 3 questions about that. And like how to care for a patient after chemotherapy, like as far as using the bathroom, what else? Like he has to have his own bathroom was one, and another one was the first sign of chemotherapy supposedly is nausea and vomiting.
Wait, the first what?
Sign of chemo is nausea and vomiting, but he didn't specify in all the symptoms that he has in his lecture. He didn't say the first one was nausea and vomiting, so everyone thought it was fatigue. What else?
So everyone thought it was fatigue?
Yeah.
You would think.
A lot of people emailed him, and I emailed him myself. And then, I realized it wasn't that bad. Like, you just really have to understand the concept of diabetes, like, how it works. And like, I don't remember all the questions, but and then you don't really have to specifically know the table, but you do have to like the average duration of the insulins.
Peak and duration.
And onset.
So to be exact, because I know.
No, to exact, like, so I know that you do have to know what type they are. So there is, short, regular, intermediate, and long. And like each of those, if you read the book, there's like tells you an average of like how much the short, the onset duration of peak of the short,
Yeah.
and the long. So like just the average, because most of them are. Like, you're not have to memorize each single one, because that table she showed us. Remember, she said just study page whatever in the book, and that table is very specific.
Oh, I don't remember that.
Yeah.
Well, so yeah, I remember I learned some little saying like 15 minutes feels
yeah,
like
she's good, that lady. Who
Yes.
got the line.
that helped me with that. So I was really like, how am I supposed to
Hold
remember
on a
this?
second.
Sure.
Hello? Hello? Yeah, I can hear you. Jim? Hey, Jim, what's up? Okay. Yeah, I can just mark that time. Okay, that's no problem. Actually, I'm glad you called me because I was already closing my but I will get it and then I'll go get it. Okay. Alright, no problem. Bye. Yeah, she's good. I like her.
I like your
You should
show.
listen to her videos.
Well, I really liked videos when because I can make them go faster. You know what I mean? So if like, because this one girl on there, she speaks very slowly, and I'm just like, get to the point, so I can kind of
Yeah.
skip it up a speed.
Yeah, so, that's what else? The other stuff wasn't bad. Like, the what messed me up, and I think what I heard a lot of people was the chemotherapy. I don't know, maybe I should listen to the lecture more in detail. Because if I would have got those questions right, then I would have been really good. Because I got all the diabetes questions right. I got, and the only one I got wrong from legal and ethical, make sure you know the MPA, the Nurse Practice Act. And then because I got confused with the Board of Nursing.
The Board of Nursing.
Yeah, there's the Board of Nursing that has some legal powers. It can do certain things, and then the MPA can do different things. So you have to make sure you know the difference, because she has like select all. I didn't get to with that because I got confused and I got all that wrong.
Oh, select all? Is that what you said?
I think she has. I don't know if you guys have the same test though.
I think we'll probably have like kind of general. But I remember her saying in class that the Nurse Practice Act and the standards
Okay.
of care, people always get them confused. So I was like, all right, so I
Make sure you
studied.
know the MPA does
NPA. But it was still very confusing because then I started listening to, NCLEX practice exams on YouTube, just because there's always these things that come up on a test, and I'm like, I didn't even think about that, so I'm hoping that something will come up on those practice exams that'll make me go research a little bit more about something. But I don't know what kind of questions they can have regarding the legal stuff. If you I listened to the whole thing all over again, you know, and it all makes sense, just like this morning's lecture. But those are the ones that trip you up because you're like, oh, it's common sense, but.
Yeah, that's true. And I'm just like, there's not the concept of like, you know, ethics.
Right.
So that the concept of like, she gave you definitions on the slides of I think it was attitude, belief, or whatever values. So I know the concept of that.
Attitude, beliefs, and values.
And morals. But like, if you understand like, if you listen to her lecture, that's what I did too. And if you understand the concept behind, you know, what she's trying to explain to you with ACA, the Joint Commission, all those national entities, that's also important that you understand. Yeah.
When I look back at my notes after, and I'm just like, because again, it just makes so much sense. So I didn't write a whole bunch of notes down, but then I didn't have like a lot of notes on it, and I didn't really remember. So I know that was
listen to
really
her again and then write down notes. But what else? And then the cancer stuff from Toto, like, was about what makes me humble was around some of his questions. Like, I don't feel it was. And he didn't have like. He had like 2 long questions, I think, but not anything like about the pack per year. Remember?
Yeah.
That, and then he had to do a calculation about it wrong. There were 2 calculations.
from like the same type of calculations from last time.
It's pretty simple, it's not that bad. Just make sure you know, I think, pounds to kilograms. Yeah.
Okay.
But instead, you just divide it by 2.2, it's like pounds. And divide it.
Well, thank you. That would actually mess me up. And those are ones that you just like.
Yeah.
Yeah.
I wouldn't think that would put that by the day.
No.
I don't remember what else. But, let me see. But I really got most of them right. I think you just have to understand the concept. On hyperglycemia, she had a question that everybody got wrong, but it was the symptoms of hyperglycemia are polyuria, polydipsia, and above BMI, above 25 BMI. But those are 3 like signs. It can be either DKA or HHNS, right? No, that's only HHNS because it's obesity.
Right.
For hyperglycemia, but she had those choices, and those were the right choices. But then she had other choices that also make sense. But I don't know why they were right. But luckily, I picked the right one. So it was the polyuria, polydipsia, and the BMI above 25. That was the answer for hyperglycemia. Those 3 right there.
Those 2.
Yeah, that's it. Okay. Yeah, so remember that. I think I read that version.
They do it on purpose.
I don't know. And they're talking, how they always email the professor, but like, I don't know if they give me things back. But that's pretty much it. Like, I don't know. It was low, the average. Well, it was 82 compared to like, I think some people got like 97 in the diabetes question. I really missed that the diabetes in the previous exam because I didn't learn the names of the hypertonic fluids. I didn't learn the names, and I knew the material so well because I studied that. I didn't learn the names.
Like the 9% or 0.9%, like those. What do you mean?
Yeah, the 0.9%. Well, that's pretty much it.
I kind of forgot that since last time because I had it for the test and then.
Yeah, but no, you don't need that for classes. But I just meant like last test.
Yeah, but I need to relearn it for.
Yeah, you do. But you put it for like in practice, but
That's I have ISIN for clinical, and she's just no joke, like, because I really kind of liked her before I had her for clinicals. Yeah, she threw me off. She wasn't very nice the one day. I guess it was day 2. Day 2, yeah. It really wasn't my fault. I was listening. The nurse was telling me what to do regarding, if you give them all the meds at once, and then, so she's like, so what are you going to get? And I said, well, the nurse told me to give all the meds, and she just like freaked out. She's like, that's not what I told you, da da da. And I'm like, you're not listening to the nurse. And I'm like, how the hell am I supposed to know that? But then she's really nice afterwards, and already at that point, I was just like, my night was really.
I know what she's had her for a lab.
Oh, the same way?
Yeah, because I had for competencies for like the needle, like I forgot to put the needle. She's like, no, oh my God, what did I do? But like, luckily, and then for our pharmacist, I had to respond to everything. So like, it was okay, but she does tell you, like what you're doing wrong, which I like because I have Jordan right now for lab, and she doesn't even look at you when you do, so she's on the phone. And I don't like that because I want to tell me what I'm doing wrong.
Right. I don't worry that I'm going to get yelled at, because ever since then, I'm just, it kind of just ruined it. Because I really liked her Portia's personality, and I like that. But it was, like, after that, I was just, like, very, I don't know, just put off, and that didn't bring me up. That put me very much so down. You know what I mean?
It's not take it personal. I think she's just like,
She said not to take any, she's like, I made people cry, but that's really not my intention. She started off the whole first day like that, and I was like, oh, well, but I understood. As soon as she did that, I was just like, crap, you know what I mean? Like, it was not, what's the other one? It was productive, it wasn't, and I'm all good with, giving me a push, right? But you didn't, you made me feel bad that you yelled at me, and then you're cool afterwards, and you expect me to just like, it's not over in my head. Like it just completely ruins it for me with her, with it, and she's like, Dane will do it, and I'm like, and I said, well, is there any way that I can maybe see you do something first, just before, so I can give you 80 milligrams of Lasix, which apparently is a shitload. And the nurse was just like, you just want to make sure you're really slow, because it can go to death if you do too bad. It's just a lot of pressure. It was right after she yelled at me, so I was already just really nervous about it. And she's like, no, why would I show you first? Like, that's what you learned in class. And that, and she's like, it's the same thing. I said, well, it's a little different in real life. She's like, no, it's not. And the next time I saw her, she's like, yeah, I asked another instructor if they ever showed somebody first. And they said, no, nobody's ever even asked. I'm like, really? Yeah. I'm like, it's just very different in life. When you do it in real life, they don't know where it's a real person, and you do a straight cat. And we haven't done that since the first semester. She's like, Dane will do it. And I'm like, oh, I don't remember. What's a straight cat shit? So luckily, she wound up just leaving the room, and it was the nurse, me, and the tech. And, the nurse just really walked me through it. And yeah, she handed me the kit, the sterile kit. Here you go. And I'm like,
it's not that bad. Because I like freaked out, so I went to like labs on Monday after my break. Because like, people were doing that. I'm like, I don't remember doing this. So I went back and did it.
yes, I didn't even do that.
Like that.
Yes. I'm like, oh, that's why I need to go to 11. I need to like kind of relearn all of that. Yeah. So it's just very stressful now. I don't like clinical because I'm just very like,
Don't be like that. And you won't learn this. You just have to.
I'm going to be forced to learn because she's going to make me learn, which is cool. It's just not the other part. Feel that. But I'm all good with, giving me, She said by the time you're done with this, you're going to go, oh, I know how to do everything, and you're going to confident.
As long as you feel that way, I'll be okay.
Yeah.
Oh, do you mind if I ask you a couple questions regarding, see if you know, regarding the insulin?
Sure.
Well, not regarding insulin, I guess, but
I feel like there was a question on the test, it may have been a couple semesters ago, regarding a patient is NPO and they need to take their meds, or they're going for surgery, they're NPO, they need to take meds. And we apparently were expected to know that answer. Do you remember that? As to what to do?
There was a question, the first question, and the answer, I don't remember the choices, but it was telling me, nurse has 4 patients with, usually like all the patients' sugar levels, and like the type of insulin or whatever. There was one that was NPO, was supposed to go to procedure. But the answer was the one that has the longest sugar level, the highest sugar level, and the one that has regular insulin, because regular insulin is going to take longer to, the peak is longer, so that's the one that you have to do the insulin because it's regular insulin, so the peak is longer, so you have to treat trays are passed out to the women eat. So just pick the one that has the highest sugar level in regular insulin.
Well, so regular is what?
It's 30, yeah, 30 minutes.
And then, so it's also called
That's the regular, no, short is regular. So the rapid is the LAGO.
30, and then it's, so it's 6, 18, 8. Sorry.
It's 30 to 8. So it's 30 to peak and 8 on reservation. Is that what you're looking for?
I guess, yeah.
So,
But why if you're taking regular, because 30 minutes is pretty soon.
yeah, but the other people were taking rapid. So
And they
that
had a
person,
high.
yeah, so that person is taking a rapid, the reaction from the insulin to the glucose to go low is going to be more faster. There's only 15 minutes also, right? So the person that has the high glucose, that person has short insulin, regular insulin. So that type of insulin takes 30 minutes to start. So that's why that's the first one you have to give, because that's the one that's going to take the longest, and he had the high blood sugar. That's why.
And they weren't NPO, that was that.
No,
Okay.
that was just the shot, the NPO. So don't worry about that.
Oh, okay.
There was another one that said, I don't remember what the question was, but it was all different choices, and the answer was, give insulin still. I don't remember what the answer.
Did you get it right?
Yeah, it was right. Because it was hard to answer that question because I was tempted to say wait an hour longer. That was one of the answers. But that answer was give insulin still. Give insulin as order. Don't call the doctor, none of that. Just call the doctor, hold them for an hour, just give insulin as order. Was the answer.
Now, do you feel like that's something that we should automatically know?
Yeah, because remember she said, even if they're sick, they have to take the insulin.
Maybe take more.
Like you can give the insulin and then call the doctor to see if you can like up the insulin dose, or like you never like wait.
And call the doctor before you do? Is it insulin only?
Well, it was already ordered, so like
Right.
the person already, I think, I don't know what the question was, so I can explain it, but I think he had high glucose. So you're gonna continue to give the insulin as ordered, the way that the answer was, and then that's the answer. And then I think the reason is because you can stop your insulin, you have to give the insulin, you know. It was a long insulin, also for like insulin. So you give the insulin, and then maybe after that you call them about that. The first thing you give the insulin as ordered, you don't just don't give it because the glucose is high, and you wonder why. Yes. So that was the answer. And then,
So I know the slide, she actually skipped over it, so I went back to listen to the lecture. I'm like,
oh, and there was a question about that losartan. I got that wrong. Remember losartan? It was for microvascular disease, but I don't know the answer to that one. Losartan?
Mr. Micro.
Microvascular disease? Those are like the chronic complications that come after 10 to 20 years after diabetes.
In the small, like feet, or,
Well, it's micro and macro. Micro is the normal, and macro is the big, right?
yeah, like heart disease.
Yeah.
I don't remember their name in it, but she discussed.
Losartan. That's the one for high blood pressure. But like she had a question about that medicine, like what are the benefits? So like look for the benefits of that medicine. I don't remember what that was. So
Okay.
that's it.
Thank you. What is, do you know when, one of the questions was, do you know when insulin should be held? What are the sugar levels?
Or like there was a question about hypoglycemia. So you do. Okay, there was a question about you go in the room when the person is sweating or like like comatose and he's going to hypoglycemia. So what's the first thing you do? So you check the blood glucose.
Okay.
Okay. What else about hypoglycemia? I don't know about all of these. To be honest with you, there was some question on this.
We don't know the numbers as to like, if we're gonna give it to them before they eat, right? So
Well, like, if the person has like a low glucose level for hypoglycemia, what you do is you give it 15 grams of glucose, and then what you do next is you check the blood sugar after 15 minutes. And then if it is still low, you do the same thing. If not, then you do this.
But what if they're not like hypo, but they're just not, so I just don't know, like, if they're about to eat, we check their blood sugar. Basically, I know, I could be in the hospital, you're doing a sliding scale, so it's between certain and doing a certain amount of units, but if it's like 100, I'm still giving them something?
Well, the normal, the sugar level, the normal glucose level is 70 to 100. That's normal.
So are we not giving it to 100? It's in that range? Like, I don't know where we kind of go, okay, well, we're not going to give it to them because it's in a good range already.
There wasn't any question like that.
Yeah.
Like, the main thing you have to think of is you don't just stop giving insulin, that's the first thing. And you just, if it is hypoglycemic, obviously you're not going to give insulin.
You're going to check the blood sugar.
Yes, so that would be the only way that you don't give insulin, obviously, if they're hypoglycemic. That's like,
Okay. Even if it's in a normal range, we would just give it because they're about to eat, so it's going to increase.
yes.
Okay. Okay. How many times do we give, like either rapid, regular, or intermediate in a day? Yeah. Like, so if I take the long acting in the morning.
So the long is one time.
Right, so that's one, but
I don't know like the times. I think it's in the book.
that's it.
And
Okay.
there's a chart in the book with all that, like, but I don't know.
Well, I saw it gives the peaks sometimes,
But
but
I think what you have to know is the onset, peak, and duration. That's the main thing.
I was just curious, not even just for the test, but just in general, because
I really don't know. Like, I know that, like, I think, like, regular, you give most of the patients I say was well before and after lunch.
Yeah.
Like, the same as that.
before and after.
Like, maybe before each meal.
And do you do snacks too? Because I don't even.
You do snacks, I've seen, but that's just something that I said that was about in the books. You might have to read the book.
I kind of went through, but I didn't see like something.
Maybe look at the pharmacological book. There's also,
yeah.
yes,
Yeah, I did.
that's more like medical.
Okay. Do you know anything about keeping insulin in the refrigerator or anything?
I think it's 30 days. I don't think she should go over that. She did go over that on her conversation. I think it's 30 days when you over it.
Can it be out of the refrigerator if it's not open?
Yeah, if it's not open, you can leave it out. Like when you're at a pharmacy, you just stock out, and then whenever you have to put it in the fridge, you can open it. That's when you have to put it in the fridge.
Because I thought I heard something different on YouTube where it said basically open or not.
It's better if you have it in the fridge, but I've seen it. Like, I don't know if she told that or not, but there wasn't anything in the test for that.
Do nurses have the authority to decrease the insulin? Like if oh my gosh, I don't know, like
That's what confused me too, because no, you have you haven't even order to decrease the insulin. I think that's something I don't want to confuse you because I really don't know. There was, I think, people saying in the test that they got confused because there was a question about decreasing the insulin, and like the nurse was not supposed to do that. But I don't remember that question, so I really don't know.
okay.
Yeah, I don't know.
So you don't know whether they got it right or wrong.
No, I don't remember. I don't think there even was a question. Maybe there was a choice, but that choice was wrong. Because I don't think you out there, you needed an order.
Well,
Obviously, if the patient is hypoglycemic, obviously you're not going to give insulin, you know.
if the patient chooses not to take it,
Yeah, then you just,
then they don't.
that's like supposed to like any arrangement or whatever.
Yes.
Yeah.
Autonomy.
Yeah,
So they have-
that was a question about autonomy.
Oh, was it?
Yeah.
They have control over it.
Yes, that was the exact thing.
Oh. Did you see everybody like you're whenever you go into a room like did you wear gloves to do the meds?
The test.
Clinical? Clinicals. Yeah. Yeah, or gloves.
Oh, yeah.
Well, I think, well, she's like, would you go with her? Well, no, I said, should I? I thought I should, because I'm about to open them and put it. She said, would you wash it in, right? No, actually, I didn't, because I really did, because we walked right in, I was following her.
I think it would go there.
But she said, no, nobody does it, but I'm thinking, I would want someone to wash their hands, because you're opening those things, you have those little pills, and so
Yeah.
easily.
I didn't think I washed my hands. I should.
Where are you?
I'm in North Florida.
Okay, yeah, so they don't have the little, you know, the foam or whatever, like right outside the door, like Shan's, or VA.
Yeah, they do.
They didn't, we are in the car yet, because they have it in the room, it's like,
Oh, that's true.
not having somewhere convenient.
Yeah.
Like on your way in, it's not on your way in.
Yeah, I remember that. Yeah.
Well, thank you, oh my god, I didn't do well in the first test, so I'm like really concerned that if I don't do well in this one, that,
Did they let you take, like, why did they let you take it later and you just couldn't make it?
sick, not feeling well, sick all weekend, but I had full intentions, like everything was packed, my car, everything. And I was just feeling really sick, and so I wanted to not coming. But I was like, I'm gonna go to the doctor then, you know what I mean?
Mm-hmm.
So, but there's something that comes off the right call first, so I don't have to call. And I could email them, but I didn't do call to them. Well, so that's what I sent it today. To the
Is that right here?
says us Branson. He's like the
Focus teacher.
core faculty or something.
Yeah,
she said that
Branson
Ransom was
was there.
there. Well, I didn't know that Ransom was. I just wound up emailing all the instructors on the tests. So I was like, so I just did all of them. But I guess how do you know that Ransom is me?
It's on this list. I didn't know, somebody told me. Yeah, I didn't know.
So everything's in your handbook online.
Yeah, they told you.
So I really did, and I skimmed through it, of course, but and I definitely I read about the absentee thing. I didn't read that you had the contest in the first, so I read it, I just didn't remember that. But I will not be missing any more tests, and they give you some fill in the blank and stuff, so it's like
Oh, no, you have to go in the line.
they have 4, so usually I think.